Hi there, everyone. Here I am again. My name is Bianca, one of the dietitians from Get Going. You may have seen me pop up a few times in the last few weeks. You're probably thinking, is it this girl again? It is. Hello. Um, I'm here again because it's Women's Health Week, and we're all about empowering women and educating them and advocating for them. So today we will be talking about pregnancy. I'm just going to wait for Emilie. We'll be joined by Emilie to join the live. Hi Emilie, how are you?
Hello, I'm good, thank you. How are you?
Good, thank you. Thanks for jumping on with me.
That's okay. Thanks for having me.
No worries. So as I was just saying, me and Emilie are both here today to talk about pregnancy. Emilie, would you like to tell us a bit about your background with women and in pregnancy?
Yeah, so I'm a mum as well, so I've obviously experienced pregnancy myself as well, and I've been supporting women for probably about 5 years now in as a doula, so pre and postnatal, and also as a fitness coach.
Lovely. So we're just going to wait for a few more people to jump on, just in case they're finishing up dinner, putting the kids to bed.
Yep.
Um,
Or if
so
they're like
just
my
wait.
kids, they're still running around.
Yeah, possibly as well, still running around trying to wrangle them. So
Yeah.
we'll just see if a few more people will hop on. But otherwise, yeah, just let everyone know we're here talking about pregnancy, exercise in pregnancy, and nutrition in pregnancy.
All right. Very exciting.
I
And
know it's
maybe if
exciting.
anyone has, people are able to put questions down the bottom here. Like,
Yep. So if anyone has any questions, as we go along, at the end we will be doing some Q&A. So we'll be answering questions, or even if we see them pop up as we go, we can answer them as we go as well. So if you do have any questions, please do put them in the box down the bottom, and we will aim to answer them as we go along or at the end.
perfect. Alrighty.
Oh, good. A few people have hopped in and ready to go. Would you like to start, Emilie, or would you like me to start?
I can get started. And sorry, my eyes are watering, so I'm not like it's just because it's late at night. So just in case. Um, so welcome to anyone that missed the first little bit. My name's Emilie. I'm a health and fitness coach for Get Going out in Geelong. So I have been helping women for, probably the past 5 years with in fitness and as a doula, supporting women in childbirth and also after childbirth, during postnatal. So I think the biggest thing that I wanted to talk about today is, I mean, there's so much information out there about pregnancy and about what you should eat, what you should do for exercise. People very, very fearful. I think the number one thing I get is when people are really fearful, saying, I don't want to put on tons of weight. Um, and I think that people get very overwhelmed with the just massive amount of information that's out there. So what I want to sort of tackle today is, the first thing is that it is normal to put on weight during pregnancy and healthy. So try not to focus too much on, I don't want to put on too much weight. I don't want to get unhealthy. I mean, obviously you want to stay healthy and fit, but within a healthy level, and within your comfort zone. And the other thing I wanted to tackle as well is just the frequently asked questions um, that I often am asked. So I think the biggest one is, what exercise can I do? So that one, what we're going to do today is just break it down for each trimester, because what exercise you can do varies quite greatly depending on the different trimester that you're in. So we're going to talk about, yes, what exercise can you do? Is it dangerous to exercise? So a lot of people ask me that, and a lot of people will not do anything because they think it's dangerous. Um, a lot of people ask me about when they know that you're not supposed to lie on your back at some point during pregnancy, and want to know when that is. And they also want to always know what to eat. So you can definitely tackle that one, Bianca. Um, they also want to often ask me about jumping, riding horses, bikes, all of those sorts of activities. What are they allowed to do, and what are the other sports that are sort of the huge no-nos. So I think the first thing for the first trimester is, I think the number one rule is just don't start anything new. So as soon as you find out that you're pregnant, you probably won't be feeling a great deal of symptoms. Some people do. Some people start experiencing symptoms from 4 weeks, but usually most symptoms start to come through around the 5 to 6 week mark. So the nausea, tiredness, that bloating feeling. Some people get sort of the aches and pains just because their body's tired. You start to get the food aversions and smell and things like that. So it's best just to go with what your body feels like it naturally should be doing. So if you have been a runner, so people that you see that are still running, while heavily pregnant, they're still running 10 kilometers, that's because that was totally normal for them prior to being pregnant. So don't suddenly decide that I got pregnant, so now I'm going to start training for my half marathon. That's massive no-no. So stick to what you already can do. The main goal is just to maintain your health and fitness. The biggest thing to watch out for, especially in early pregnancy, and is very especially if you're not feeling any symptoms. If you are feeling symptoms, you'll probably naturally just slow down and take a bit more of a rest. But if you're not feeling symptoms, chances are you'll just keep going and you won't even notice. But you need to be careful of your heart rate, your blood pressure, and dizziness. So they're probably the top three that we look out for as trainers, is making sure that we're giving you a few extra breaks. You just need to be a bit careful of high intensity. And this is in any stage of pregnancy, but especially in the first trimester, because we often don't look out for it. So you forget about it. So in early pregnancy, because your body's starting to prepare for the baby, your blood pressure starts to change and your heart rate starts to get a bit faster. So if you put yourself in a situation that you're doing high intensity exercise, what can happen is that you can your heart rate can increase quite rapidly. You can become dizzy and faint, and your blood pressure can drop really quickly as well. So you've got to be a bit careful of that, because we also don't want you to fall over. But then also you can become dehydrated very quickly. So we need to make sure that you're hydrated regularly. You take a few extra breaks. So even if you're normally used to high intensity exercise and you want to keep doing high intensity exercise, that's fine. But just make sure that you're taking a few extra breaks and getting your heart rate to come back down. The other big things to watch out for these are the huge things that you must do if you are quite an active person. When you become pregnant, please tell your personal trainer if you feel comfortable, or maybe just hint that perhaps you need to be a bit more careful if you don't feel comfortable, just so that we're training you appropriately. Definitely big no is high impact sports. So any sports where there's contact, so basketball, football, sometimes netball, boxing is another one, just simply because you don't want any impact to the body. And anywhere where you're in a heated environment. So Bikram yoga is probably the biggest one. So anywhere where you're in saunas, spas, because you overheat so quickly. So then maybe over to you about nutrition.
Lovely. Thank you, Emilie. That was like so amazing. There's things that I don't even know about. There's a lot of things I don't know about exercise. So this is all an experience for me as well. So audience, sorry, for me too. So I guess with nutrition, it does really start from preconception nutrition. So I think we're all aware good nutrition during pregnancy is vital in ensuring the health of mum and baby. And that does start with preconception nutrition, as research has been very clear that the things you do before you're pregnant can affect your future pregnancies and your children and the health of your future children as well. So we know that many Australian women are not meeting their requirements for folate, iodine, or iron. So when planning for pregnancy, the NHMRC recommends that you should be taking a prenatal supplement or thinking about your preconception nutrition 1 to 3 months prior to trying to conceive. Ideally, though, this will be 3 to 6 months prior, and up to a year if you're coming off of the pill or contraception, because contraception can deplete you of certain nutrients. I won't be going into that today, but just a little bit of a red flag there. So improving your nutritional status prior to conception can help avoid delays to conception, support ovulation, and also prevent nutrient deficiencies in pregnancy, especially in the first trimester when, as we've just talked about, nausea and vomiting may be present. So trimester 1, I think the most common myth when you're getting pregnant is that you're now eating for 2. Unfortunately, it's not true. In fact, it's more like 1 and a bit. It's not even quite 1 and a half in terms of how the food servings sort of increase. In the first trimester, many people undergo, I guess, the common pregnancy symptoms of nausea and vomiting and extreme fatigue. The expected weight gain during the first trimester is usually only around 0.5 to 2 kilos for the whole first trimester. And I guess that's because, again, that's taking into account nausea and vomiting and the fact that you're probably not feeling so great in the first trimester. Energy needs don't increase too much in the first trimester, so it's more about it focusing on those specific nutrients. So one of those main nutrients, which I've sort of just mentioned, is iodine. So iodine is involved in the development of the thyroid hormone, and the thyroid hormone is involved in regulating your metabolism and has a key role in brain growth and development. So that's for brain growth and development of baby. During pregnancy, iodine requirements increase as your thyroid activity increases. So we can find iodine in foods such as seaweed, dairy products, eggs, and seafood. Another nutrient that is important to include in the first trimester, and it's another one that we know that we should include, is folate or folic acid. So folate is also known as vitamin B9, so it's one of the B vitamins. It's essential for healthy growth and development also, as it contributes to DNA synthesis, cell repair, and growth. If you're wondering what the difference is between folic acid and folate is, well, folic acid is the supplemental form, which is commonly found, obviously, in supplements, where folate is naturally occurring in foods like your leafy greens, your legumes, cruciferous vegetables, so things like your broccoli and Brussels sprouts, and also in folic acid fortified breakfast cereals. So basically, if I had to give pregnant mamas a goal for the first trimester, it would be to continue your pregnancy and prenatal supplement, as it does ensure you have the right amount of vitamins and minerals to support the healthy pregnancy. If you are suffering from moderate to severe levels of nausea, vomiting, or fatigue, what we're most concerned about is whether you're able to keep your prenatal down, and in order to curb that nausea and hopefully, I guess, maximize that intake, you should be having small, frequent meals. And when you are feeling good, aiming to maximize your intake as best as you can. So back to you, Emilie, for trimester 2 exercise tips.
Fantastic, and lots of that I learned too. And I think going back on, severe, especially when you're severely nauseous and exhausted, or if the nausea goes all the way through. So if you're lucky, I had this, and I had 2 pregnancies where I was nauseous and exhausted for the whole 9 months. Exercise can become very, very challenging, and you may have been extremely active prior to pregnancy. And when you come into this quite shocked because all of a sudden it seems so far out of reach to do what you used to do. And at quite sometimes a very early stage. And it also can be quite devastating too. I know for me it was quite devastating because I was quite fit and all of a sudden was really not. And I went into postnatal as well, which we can talk about another time. But what I suppose you want to try and do is just try and make little tiny gains. So if that means that it's simply that you walk a couple of times down the hallway, or you walk a few times, do a few step ups. So, you try and do 10 step ups one day and then say, okay, the next day I'm going to try and do 12 step ups, or I'm going to just try and do a few squats off the couch, things like that. So just try and keep small gains, and hopefully that will be at least something so you can keep up your exercise habit so you don't get to postnatal and have to start all the way from scratch again. So in the second trimester, if you are feeling good, which sometimes around the sort of 12 to 16 weeks, it can take till 16 weeks to start feeling a little bit better. Then you might suddenly pick up and have energy, you're sleeping well, maybe not as nauseous, diet might be a bit better, so you might have a little bit more nutrients in there. And so you can usually, what I usually find is most people in pregnancy can kind of go back to most of the exercise that you used to do, unless it's a dangerous exercise. So the only time you wouldn't go back to the normal exercise you were doing would be if it's not safe. So if it's a high contact sport, it's something that will put you at risk, extremely high intensity, or your doctor has told you that it's not safe for you to do. So there are medical conditions that during pregnancy, it's not safe to do certain exercise, especially jumping, or if you do any sort of star jump type movements where your legs are coming out, opening the pelvis, and a high impact type movement. So then you need to be a bit careful on that. But otherwise, most exercises should be okay. At around 25 weeks, though, you should stop being on your back. And this is just simply because it's dangerous to do so. And most doctors will tell you that at least at 25 weeks. Sometimes we do it even earlier than that. So sometimes we might even start getting you into the habit of not being on your back from around 20 weeks. So what we usually try and encourage you to do is start using, say, things like a fit ball. So an exercise fit ball, which you can just get from Kmart. You don't need to spend heaps. And that just can change your lying position. So from your crunches and sit-ups to an incline position, which that is totally fine. So if you're in an incline position and you can start doing, say, small movements like on an incline, that can help you. It also stops the impact on your core. So what we need to stop doing at this stage and into the third trimester is any intense core work. So no more planks, intense push-ups on your toes, burpees, all of those sorts of exercises. Usually we start to incline them to stop that intensity in the abdomen. And the reason we do that is we want to try and minimize the pressure on your pelvic floor, because your pelvic floor is soon going to have a lot of pressure on it from baby's head. So what we also try to look at as well is start engaging the pelvic floor, and perhaps talk a little bit more about how your pelvic floor connects with your core, depending on what level of exercise you're doing. And then we also look at your overall functional strength and your cardio fitness, mostly either to maintain whatever exercise you were doing, just so it's enjoyable, but also to prepare you for birth. Because later on down the track, when you get down towards birth preparation, we need to start looking at that endurance cardio. So we usually start to prepare you for that. So squats are really good, lunges, lots of walking, swimming. If you were a runner, it's running, things like that. So over to you, Bianca.
Lovely. Yeah, so similar to what Emilie was saying, during trimester 2, hopefully your appetite has come back and most of the nausea and vomiting has subsided. Again, for some women, it'll go through the whole 9 months. My mum was one of those people with both her pregnancies, nauseous and vomiting for the whole 9 months. So unfortunately, there will be those cases where it won't subside, but hopefully, in most people's case, it will have subsided at least a little bit. So now is the time that you can really actively prioritize your nutrition because you're feeling a bit better, not as nauseous, not vomiting, and hopefully not as tired. Hopefully that's sort of subsided as well when you're sort of getting used to this new amazing pregnant body of yours. So at this time, baby is really growing and you'll get to feel those little flutters in your tummy when your baby starts kicking. So I guess at this point, we want to be focusing on the increased food groups. So in terms of food groups, your grains food goes up by 2.5 serves and your protein food goes up by 1 serve in pregnancy. For this reason, we advise that you add maybe another protein containing snack or 2 to your day just to bump up your energy and work towards meeting those nutritional needs. 2 other important nutrients will be your calcium and vitamin D. Again, in pregnancy, we do like to focus on those specific nutrients rather than the food groups as a whole, even though I've just negated that by telling you about a whole food group. But generally, it's about the nutrients that are contained in that food group and to get the energy in. As an example, the growing baby takes calcium from the mum's stores for bone growth, teeth eventually, and bodily processes. So we need calcium from our diet as our bodies can't produce it on its own. Vitamin D goes hand in hand with calcium as it assists with calcium absorption. There is also research to say that women who are vitamin D deficient during pregnancy are more likely to be at risk of pregnancy complications, such as preterm birth and preeclampsia. So enjoy some time on a daily walk and get some sunshine. B12 is another nutrient that is super important, super important during pregnancy, and an important nutrient to be including in your pregnancy diet. And this interrelates again with trimester 1 and 2, really. So all of our B vitamins aid in energy production and energy conversion. However, B12 and folate both rely on one another to work correctly. So women are obviously very well versed in folate and know they should be taking their folic acid supplement. However, consuming high levels of folic acid or like levels of folic acid that's sort of above normal can mask vitamin B12 deficiency. So it's important that you are having a visit with your GP well before you're trying for a baby, so they can have a look at your bloods and before you have attempted to, I guess, prepare with any supplements. So we know, I guess, which supplements are really important to include for you as an individual. Back to you, Emilie.
Fantastic. Okay, so third trimester. So this is a really exciting trimester because you're getting ready, obviously, for the birth of baby. And this is usually when exercise will just naturally slow down a little bit and become lower impact because you start to obviously feel bigger, with the belly. And everyone's very different in this area. Some people slow right back and find exercise very difficult because you become out of breath. It becomes harder for you to breathe in terms of if you were doing really fast walks or high intensity exercise. But look, walking is probably the number one best exercise to do, especially in the third trimester. It's always great, but definitely in the third trimester because it keeps up that cardio health, keeps you mobile and moving, because what you don't want is to become very sedentary and everything starts to stiffen up and becomes quite stiff, so that when you have your baby, it's a lot more difficult to sort of get moving again, and you start to get injuries and pain, especially in the upper back. Swimming is also another one, and I would strongly recommend, if you are obviously not during lockdowns, but if we are not in the lockdown and you can access a swimming pool or the beach, I strongly recommend that you do swimming because it's extremely good for you, good for your cardio health, and great for your strength. Some people do find bike riding still okay. Again, that's going to be a little bit individual. Bike riding is okay during pregnancy, but in third trimester might be a little uncomfortable. But I do know many that still do it. So if you've always done it and you feel comfortable and you want to keep doing it, that's okay too. If you're in the gym environment, though, it's probably best just to be on the seated ones rather than on the little seat. So with your legs out, because it just might feel a bit more comfortable. That's all. The other thing that we usually start to look at as PTs is we start looking at birth preparation. So resistance bands are a really great one to have at home, or small dumbbells because you want the lighter weights, and also just for convenience. We want to stop having anything being carried on the back. So if you are used to doing sandbags or barbell work, we usually say to stop doing this in the third trimester, just simply because of the load on your back and the pressure, the abdominal pressure onto your pelvic floor. So in the third trimester, you want to start reducing extra pressure. So no more Kegel lifts. If you've sort of heard of the Kegel lifts before for your pelvic floor, we sort of say try to reduce that at that time, not do it too intensely, because you don't want during childbirth for your pelvic floor to be really, really tight so that you don't know how to then release it for when you push. You also don't want heavy lifting, so anything in the deadlift, so any really heavy lifting up above your head, and heavy lifting on your back, because you can cause injury to your placenta, and it can become very dangerous. You also can become injured in your neck as well, just simply because you're not moving quite as well either. You also need to be a bit careful when stretching as well. So you become hyperflexible when you're pregnant because of the hormones. They're getting all your muscles and joints ready to open up the pelvis. So you need to be a bit careful when you're doing stretches and make sure that you don't hyperextend your limbs. The last thing is of course, in core. So no intense core exercises. You need to make sure everything is either in a tabletop position, which means you're on all fours, similar to the birth position that you could be in. You can be on a ball, in those positions or standing. So kind of think, if you're not quite sure what sort of positions are okay, try and think when you're probably doing your birth education classes, think of the birthing positions that you would be in and mimic those for exercise, because those positions are safe and also help you prepare for birth. What we look at for your any exercises is that your core is not bulging and we're not getting doming or peaking. So that just shows us that if that's happening to your core, something is not okay, and that the muscles should be coming down. All right, over to you.
Thank you. We've arrived at the third trimester, and you'll be meeting your little one very soon. So there are 3 key things to focus on in the third trimester that I'll sort of go through now. Firstly, this one isn't quite a nutrient, but it's a big one, and it's fiber. So if you've been pregnant, it's likely you've probably been constipated at some point. This can be attributed to multiple things such as medicines or supplements you've been taking, but it's also because of the increase of progesterone during pregnancy. So progesterone can slow the gut down and cause your food to move through a little bit slower. So now constipation can be present at any point in pregnancy. However, I guess as you're approaching your impending birth, it's so crucial that your bowels are working regularly and you're able to pass your poo very easily, to put it bluntly. So the reason for this is, regardless of how your baby enters the world, whether that's vaginally or by a C-section, you're going to need to be very careful with those first few bowel movements, and it will be a no pushing allowed type of situation. Whether you've had a perineal tear from a vaginal birth, or again, you've had a C-section, so you've got a wound that's gone all the way down through multiple muscle layers, you're going to need to be very careful when pushing and when going to the toilet. So fiber is really, really important to make sure that those bowel movements are happening really easily. Also hydration, so making sure you're getting in at least your 2 litres of water, which can be hard when you're in your third trimester and you're needing to go to the bathroom every 5 minutes, but very important to stay hydrated through that whole period of time. So fiber is found in your whole grain foods, so your whole grain carbohydrates, fruit, vegetables, and legumes. The second important nutrient is iron. So I've sort of just mentioned iron all the way through, but it's important all the way through and important for women overall. Iron deficiency in the general female population and the pregnant population is around 20%, which again is unsurprising given that every second woman I know is either low in iron or iron deficient. So iron requirements for pregnant women increase by nearly 10 milligrams. During pregnancy, a person's blood volume increases by up to 50% to support both the mama and the baby. So low iron levels can contribute to greater levels of fatigue, low concentration, and in some cases, a reduced ability to fight off infection. So the final 10 weeks of pregnancy are most important for iron, as it sets up 100% of your baby's iron stores until they do begin solids at 6 months. Thirdly, the third one is fish oil. So if you are taking supplements, specifically a fish oil supplement, it is recommended that you stop taking these a few weeks prior to labour. This is to reduce the risk of bleeding associated with taking large amounts of fish oil supplements. This risk is quite low. However, there is still more research needed in terms of the relationship to pregnancy and risk of bleeding. However, it is always much better to sort of err on the side of caution and exercise safe and conservative practices. So I guess if I could summarize all of that into one take-home message, nutrition and movement is important in everyone's lives. When it comes to pregnancy, it does become doubly important for you and your baby. But the most important thing is to surround yourself with support, to listen to your body and your baby growing inside you, and to seek out advice and help when you need it.
Yeah, definitely. And I think, as a mum and having gone through this experience, myself, I think the best advice I could give someone is just to go with your gut. If it feels right for you and you feel okay and you know your body. So lots of people will tell you all sorts of different things, and unless it's a piece of paper saying it's going to be extremely dangerous and detrimental to your baby's health or to you, if you feel okay, go with what you feel's okay. Because you can get so overwhelmed with all the different pieces of information and different people telling you all these different things and the horror stories and all that sort of thing. But yeah, it just will drive you crazy. And anyone out there that's going to have a baby, I would say the same thing for postnatal as well. Just go with your gut.
Yeah, I would agree as well. I'm not a mom and I haven't had any babies yet. But I am completely aware of the bombardment of information that pregnant women get through the entire process, whether that's before you're pregnant, when you're pregnant, your labor, postpartum, and there's just breastfeeding, not breastfeeding, completely aware of the bombardment of information that pregnant women
Yeah,
get.
exactly.
So,
And enjoy it. Like, enjoy the experience.
yeah,
Yeah.
yeah, and that's right. You just got to listen to your body and listen to, yeah, like your gut as well.
Yeah.
Now I'd love to take some questions if anyone has any questions at all. I don't think I've seen any pop up along the way. I will just scroll through quickly just to see if there's any. I didn't see any pop up, but if you have asked a question, re-ask it sort of at the bottom of the screen so we can have a look. Questions, comments at all.
Or even experiences if you have anything you want to share with anybody.
Anything at all.
Yeah.
We will take them.
Yeah.
We'll just sit and wait for people to just come in and ask us all the questions and tell us all about their experience.
Yeah, exactly. That's all good.
Oh, thank you, Emilie.
Oh, thank you. Yeah, and I hope that we've been able to help, those of you listening or those watching a little bit later. I hope that we've been able to help answer some of those questions or perhaps inspire you to seek out the information that you've been looking for, because everyone's a little bit different in their own individual journey. But just love your exercise, even if it is that you're just walking around the block several times a week. Awesome. Just go with what you love and be consistent.
Yeah. I think there's no questions. We've just covered it so well as well. Yeah, beautiful.
Fantastic.
Done.
Awesome. Well, enjoy Women's Health Week, everyone.
Yeah, thanks everyone for joining us, and keep an eye out during the week for more exciting content and a few more lives as well. So have a good week, everyone.
Fantastic. See you.
Thanks, Emilie. It was so fun doing this with you.
You too. Bye.
Bye, everyone.